As a doctor, one of the things I notice most in my practice is how often older adults end up taking medications that, while intended to help, can actually cause more harm than good. Our bodies change as we age. What might have been perfectly safe for someone in their 40s or 50s can become risky after 70. The way our liver and kidneys process drugs slows down, which means medications stay in the system longer. This increases the chance of side effects and complications, even from medications that are generally considered safe. For example, a drug that helps control blood pressure may suddenly lead to dizziness or fainting, putting an elderly person at risk of falls, fractures, or even a hospital stay. Many of these risks are preventable, but only if we are aware of them. It's also important to understand that older adults are more likely to have multiple health conditions at the same time. When a person is taking several medications, the interactions between them can be unpredictable. Two drugs that are harmless on their own can create serious complications when taken together. This is one reason why polypharmacy, the use of multiple medications simultaneously, is so common in seniors and why it's such a hidden danger. A medication meant to ease pain may interfere with a heart medicine, or a sleeping pill may worsen confusion caused by another prescription. Even small mistakes in dosage or timing can have significant consequences because the margin for error in older adults is much smaller. Another factor is that our body's sensitivity to drugs changes with age. Seniors may become more prone to side effects such as low blood pressure, dehydration, or gastrointestinal issues. For instance, medications that were once effective for sleep can cause excessive drowsiness, leading to falls or accidents. Painkillers can cause stomach bleeding or kidney strain. Blood thinners, while life-saving in some cases, can become dangerous if not monitored closely. What many people don't realize is that these side effects often go unnoticed or are mistaken for normal signs of aging. Confusion, fatigue, or balance problems are sometimes just written off as getting old, when in fact they may be medication-related issues that could be corrected with proper medical guidance. It's not just prescription medications that matter. Over-the-counter drugs, herbal supplements, and vitamins can also contribute to problems. Many seniors assume that if it's sold at a pharmacy, it must be safe, but even common pain relievers or sleep aids can have serious consequences in older adults. For example, non-steroidal anti-inflammatory drugs, commonly used for arthritis pain, can cause kidney damage or heart issues if used long-term. Even something as seemingly harmless as a cold medicine can raise blood pressure or interact with other drugs. Awareness and education are critical because families often underestimate how sensitive older adults are to these substances. The key takeaway is that age changes how our bodies respond to medications. Our metabolism slows, our organs function differently, and what once provided relief can now pose a risk. This doesn't mean that seniors should stop taking medications altogether, but it does mean that every prescription must be carefully considered. Each drug should be evaluated for its necessity, its dosage, and the potential for interaction with other medications. This is why I would never allow my own mother to take certain medications after 70 without a very careful review. Preventing harm is far more important than treating a condition aggressively if the risks outweigh the benefits. Families play a crucial role here. Often, elderly patients don't speak up about side effects because they assume it's normal or don't want to bother anyone. Children and caregivers who pay attention, ask questions, and advocate for their parents can make a huge difference in preventing serious health complications. A simple conversation with a doctor about whether a medication is still needed, whether the dose should be adjusted, or whether a safer alternative exists can prevent hospital visits and improve quality of life significantly. These small but meaningful steps can make the difference between a safe, comfortable aging process and one filled with preventable risks and complications. The truth is that the risks of over-medication in seniors are not always obvious and they do not always show up immediately. Side effects can develop gradually and the consequences can be severe. This is why vigilance, awareness, and proactive management of medications are essential for anyone over 70. By understanding the way aging affects medication processing, by reviewing each prescription carefully, and by remaining alert to the subtle signs of side effects, we can keep our loved ones safe, healthy, and independent for as long as possible. Ultimately, the first step in protecting older adults from the dangers of certain medications is knowledge. Understanding that the risks increase with age, recognizing how our bodies change, and being proactive in managing prescriptions are all crucial in ensuring that seniors can continue to live safely and comfortably. When we talk about medications that can cause more harm than good in older adults, it's important to be specific, because awareness is the first step toward prevention. There are certain types of medications that I, as a doctor, would never let my own mother take after 70 unless absolutely necessary and closely monitored. These aren't just random pills. They are commonly prescribed drugs that, while helpful for some, carry higher risks for seniors. One category that deserves careful attention is strong sleeping medications. Many older adults struggle with insomnia or disrupted sleep patterns, and it's tempting to turn to prescription sleep aids. But these medications often cause prolonged drowsiness, confusion, or dizziness the next day. This can increase the risk of falls at home, which is one of the leading causes of serious injury in people over 70. Even short-term use can lead to dependence, and the brain becomes more sensitive to these drugs as we age. Non-drug approaches, such as improving sleep hygiene, limiting caffeine, or using relaxation techniques, can often provide safer, effective solutions. Another class of concern is powerful painkillers, especially opioids. While these medications can be necessary for severe pain, they carry serious risks for older adults, including constipation, slowed breathing, cognitive changes, and even accidental overdose. Older adults metabolize these drugs more slowly, so the effect can be stronger than intended. For chronic conditions like arthritis, safer alternatives such as physical therapy, low-impact exercise, or topical treatments often provide relief without putting the patient's overall health at risk. Certain medications for blood pressure and heart conditions also require caution. Drugs that dramatically lower blood pressure can be dangerous if taken without monitoring because they can lead to sudden dizziness, fainting, or falls. The risk of injury is compounded by age-related changes in balance and reflexes. Similarly, high-dose cholesterol medications, while effective in younger adults at preventing heart attacks, may not provide the same benefit in people over 70 and can strain the liver or cause muscle problems. Each prescription must be evaluated in the context of the patient's overall health, not just the numbers on a chart. Even common over-the-counter medications can be risky. Anti-inflammatory drugs, which many seniors take for joint pain or headaches, can cause kidney damage, stomach bleeding, or worsen heart conditions over time. Cold and allergy medications can increase blood pressure, cause confusion, or interact with other prescriptions. This is why it's so important to treat every medication, prescription, or over-the-counter with the same level of scrutiny, especially for someone in their 70s or older. The danger isn't just in individual medications, it's in combinations. A sleeping pill plus a painkiller plus a blood pressure medication can create a perfect storm of side effects that may not be obvious at first. Confusion, unsteady gait, frequent falls, or unexplained fatigue may be mistakenly attributed to aging, when in reality they are warning signs of harmful drug interactions. Recognizing these risks allows families and caregivers to step in, review medications with the doctor, and make safer choices. Ultimately, the principle is clear: medications should help, not harm. After 70, every prescription needs careful consideration, and the risks often outweigh the benefits for drugs that younger adults may take routinely. As doctors, we must weigh the necessity of each medication, monitor for side effects, and always explore safer alternatives. Families must stay informed and involved because their advocacy can prevent unnecessary complications and protect the health and independence of their loved ones. One of the most important things I emphasize as a doctor is the need to review medications regularly, especially for someone over 70. It's not enough to simply write a prescription and assume everything will be fine. Our bodies change as we age, our health conditions evolve, and what was necessary last year or even last month may no longer be appropriate today. Regular medication reviews allow doctors, patients, and families to evaluate the necessity, dosage, and safety of each drug. This proactive approach can prevent complications before they arise. Many older adults are taking multiple medications at the same time, sometimes prescribed by different specialists who may not always communicate with each other. Without careful oversight, this can lead to dangerous interactions or cumulative side effects. For example, one doctor may prescribe a heart medication while another prescribes a painkiller or sleep aid. Individually, each medication may be safe, but together they can cause confusion, excessive drowsiness, low blood pressure, or even more severe outcomes like hospitalizations. This is why routine medication checks are not optional. They are essential for safety and quality of life. A medication review isn't just about identifying risks. It's also about assessing effectiveness. Older adults often continue taking drugs that no longer provide meaningful benefits. Cholesterol medications, certain painkillers, or high-dose vitamins may have been helpful at one stage of life, but continuing them past 70 without reassessment can create unnecessary stress on the liver, kidneys, and cardiovascular system. These reviews also provide an opportunity to simplify medication schedules. Fewer pills at safer doses can significantly reduce the risk of mistakes, missed doses, or accidental overdoses. Families play a critical role in this process. Elderly patients may feel hesitant to question a doctor's prescription, assuming that more medication is automatically better. Children and caregivers who actively participate in medication reviews can make a profound difference. By asking questions, tracking symptoms, and reporting side effects, families help ensure that each medication truly benefits the patient rather than causing harm. In my experience, caregivers often notice subtle changes like increased confusion, fatigue, or balance problems before the patient even realizes something is wrong. These observations are invaluable when reassessing medications. Regular reviews also allow for exploring safer alternatives. Sometimes a lifestyle change, physical therapy, dietary adjustment, or even a lower dose medication can achieve the same therapeutic goal without the risks associated with high dose or multiple prescriptions. For example, exercise and stretching may improve joint pain and mobility, while relaxation techniques and sleep hygiene can reduce dependence on sleep medications. These alternatives not only minimize side effects, but also empower older adults to take control of their health. Ultimately, medication reviews are about maintaining both safety and independence. They prevent harm, reduce hospital visits, and improve the overall quality of life for seniors. By actively managing medications, doctors and families can ensure that treatments remain appropriate for the patient's current health status rather than sticking to outdated prescriptions. For someone over 70, this vigilance can mean the difference between feeling strong and alert or being burdened by preventable complications. The simple truth is that medications should support life, not complicate it. Routine, careful review is the most effective way to make sure they do. Beyond knowing which medications are risky and reviewing prescriptions regularly, it's equally important to consider safer alternatives. Too often, the focus is only on pills as solutions, when in reality, lifestyle adjustments and non-drug approaches can be just as effective and far safer for older adults. As a doctor, I've seen firsthand how small, consistent changes can dramatically improve health without adding unnecessary medications. For example, sleep problems are extremely common after 70, but relying on strong sleeping pills can be dangerous. Instead, establishing a regular bedtime routine, limiting screen time before sleep, reducing caffeine, and creating a calm, dark, and quiet sleep environment can work wonders. Gentle exercises like yoga or stretching in the evening, or simple relaxation techniques such as deep breathing, can help the body prepare for restful sleep. These methods may take a bit more effort than popping a pill, but they are far safer, and they also improve overall well-being in ways medications alone cannot. Pain management is another area where alternatives can reduce reliance on drugs. Many older adults suffer from chronic joint pain, arthritis, or back discomfort, and the instinct is often to reach for strong painkillers. Yet physical therapy, light exercise, weight management, and supportive tools like braces or ergonomic furniture can significantly reduce pain while strengthening the body. Topical treatments such as creams or patches can target discomfort locally without causing the systemic side effects that oral medications sometimes do. These approaches may not be as instant as a pill, but they allow seniors to maintain independence and mobility safely. Diet and nutrition also play a key role. High blood pressure, high cholesterol, or blood sugar issues are often managed with medications, but thoughtful dietary changes can complement or sometimes reduce the need for drugs. Incorporating more vegetables, fruits, whole grains, and lean proteins while reducing processed foods and excessive salt or sugar can support heart, kidney, and liver health. Hydration is equally important, as even mild dehydration can worsen medication side effects or confusion. In this way, food and lifestyle choices become a form of medicine that strengthens the body rather than taxing it. Supplements, when needed, should also be approached cautiously. While vitamins and herbal remedies can provide benefits, they are not risk-free. Some supplements can interact with prescription medications or strain the kidneys or liver, particularly in seniors. Consulting a healthcare professional before starting any new supplement ensures that the benefits outweigh the risks. In many cases, natural sources of nutrients through a balanced diet are safer and more effective than high-dose pills. The overarching idea is that medications are just one tool in the health toolkit. They are often necessary, but they should not be the first and only solution, especially after 70. Prioritizing safer, non-drug alternatives empowers older adults to maintain their health proactively and reduces the risk of complications from over-medication. Families and caregivers play a crucial role in encouraging these approaches, supporting healthy routines, and helping their loved ones explore options that strengthen both body and mind. In the end, taking a holistic approach, considering diet, exercise, mental well-being, and safe alternatives, complements medication use and protects seniors from unnecessary harm. By focusing on safer methods alongside carefully managed prescriptions, we give older adults the best chance to live healthy, independent, and fulfilling lives. Even when medications are carefully prescribed and alternatives are considered, it's crucial to recognize the warning signs that something may be going wrong. Seniors often experience side effects differently than younger adults, and these effects may appear gradually or subtly. As a doctor, I always tell families to be alert for red flags. Early detection can prevent serious complications, hospitalization, or even long-term health issues. Confusion or memory problems are among the most common warning signs. An older adult may suddenly become forgetful, disoriented, or have difficulty concentrating. While this can sometimes be attributed to normal aging, it is often a side effect of medications, particularly sedatives, painkillers, or drugs for blood pressure. Recognizing that these changes are not just part of getting old is essential. Reporting even small cognitive changes to a doctor can lead to adjustments in prescriptions that prevent worsening symptoms. Balance issues and frequent falls are another major indicator of medication-related problems. Drugs that lower blood pressure, relax muscles, or cause drowsiness can significantly increase the risk of falls, which are a leading cause of serious injury in seniors. Even minor bruises or stumbling incidents should not be ignored. They are often the first signs that a medication is affecting coordination or alertness. Simple interventions, such as adjusting the timing or dosage of a drug, removing tripping hazards at home, or introducing gentle balance exercises, can make a huge difference. Other subtle signals include fatigue, dizziness, gastrointestinal upset, or sudden changes in appetite or sleep patterns. These symptoms may seem minor, but in older adults they can indicate that a medication is having a harmful effect. Sometimes it's not one drug alone, but the combination of several medications that creates these problems. Caregivers who track daily changes, monitor symptoms, and communicate with healthcare providers can help identify risks early and prevent escalation. It's also important to pay attention to emotional and mental health. Anxiety, depression, or irritability can sometimes be linked to medications rather than just life circumstances. Mood changes are often overlooked but can seriously affect quality of life. Being observant, compassionate, and proactive in discussing these changes with a doctor ensures that seniors receive the right care without unnecessary drug burden. Recognizing these red flags isn't about creating fear. It's about vigilance and empowerment. Families, caregivers, and seniors themselves can play an active role in identifying warning signs and advocating for safer alternatives. A timely conversation with a doctor, even about minor symptoms, can prevent major health crises. It reinforces the principle that medication should support well-being, not compromise it. Ultimately, awareness is the most effective tool in keeping older adults safe. By understanding how side effects present differently after 70, by monitoring daily health, and by addressing warning signs promptly, families and healthcare providers can prevent avoidable complications and help seniors enjoy a higher quality of life. The final point I want to emphasize is the power families have to advocate for the health of their elderly loved ones. After 70, seniors often face complex health decisions, and it's not always easy for them to